Hello friends, welcome to my channel Healthy Life. If you haven't subscribed my channel, please do subscribe, like the video and share with your friends. So friends, what is migraine? A migraine is a severe headache that causes throbbing, pulsing head pain on one side of your head. The headache phase of a migraine usually lasts at least hours to days. This headache gets worse with physical activity, bright lights, loud noise, strong odors. Migraines are disruptive. They can interfere with your daily routine and affect your ability to meet personal and social obligations. So what are the types of migraines? There are several types of migraines. The most common migraines categories are migraine with aura, that is classic migraine, and migraine without aura, that is common migraines. An aura is a phase of the migraine before head pain begins. Other types of migraines includes migraines in children, that is abdominal migraine, chronic migraine, hemiplegic migraine, menstrual migraine, migraine without headache, that is silent migraine, and retinal migraine, that is ocular migraine, and status migraneous. How common are migraines? Migraines are common. Studies shows that an estimated 12% of people in the United States experience migraines. So what are the phases of migraines? There are 4 stages of a migraine: prodrome, aura, headache, and postdrome. Prodrome is the first phase, begins up to 24 hours before you experience a headache. An aura is a group of sensory, motor, and of speech symptoms that act as a warning signs of migraine headache. The aura phase can last as long as 60 minutes or as little as 5. You might experience both the aura and the headache at the same times. Headache. A migraine headache lasts between 4 hours to 72 hours. Postdrome. The postdrome stage usually lasts for a few hours up to 48 hours. Symptoms feel similar to an alcohol-induced hangover, which is why the postdrome phase is known as migraine hangover. It can take about 8 to 72 hours to go through the 4 stages. Migraine symptoms. Migraine symptoms vary based on the stage. Every migraine is different and you wouldn't necessarily experience symptoms during all 4 stages of every migraine. Postdrome symptoms: mood changes, difficulty concentrating, trouble sleeping, fatigue, nausea, increased hunger and thirst, frequent urination. Aura symptoms: muscle weakness, vision change, ringing in your ears, sensitivity to touch, numbness and tingling, difficulty speaking or concentrating. Headache attack symptoms: head pain gradually gets more intense. It can affect one side of your head or both. It can occur with other symptoms like nausea and vomiting, light, sound, and odor sensitivity. Postdrome symptoms: fatigue, stiff neck, sensitivity to light and sound, difficulty concentrating, nausea, and dizziness. What does a migraine feel like? Migraine headache pain may feel like the following: throbbing, pulsing, pounding, and dull. A migraine can feel different for each person. A migraine headache ranges from mild to severe. Head pain can start on one side and shift to the opposite side. You may also have pain around your eyes or temple, and sometimes around your face, sinuses, jaw or neck. How often do migraine happen? The frequency of a migraine varies from person to person. You might have one migraine per year or one per week. On average, most people experience 2 to 4 per month. They are most common in the morning. Most migraines are unpredictable, but sometimes you can have an idea of what a migraine will happen, like before menstruation or after feeling stress. What causes migraine? Researchers aren't sure of the exact cause of the migraines, but studies shows genetics play a role. When you have a headache, specific nerves in your blood vessels send pain signals to your brain. This releases inflammatory substance into your head's nerve and blood vessels. It's unclear why your nerves do that. What triggers a migraine? A trigger is something that causes symptoms to start. Some of the most common migraine triggers include stress, hormonal changes, certain medications, changes to your sleep, weather conditions changes, too much physical activity, addictive substance like caffeine or tobacco, missing a meal, exposure to bright lights, loud noises or strong odors. Your healthcare provider can help you identify your triggers. They might recommend keeping a migraine journal to track similarities between migraine attacks. What foods triggers migraines? Your body may have a sensitivity to specific chemicals and preservatives in foods. These sensitivities makes a migraine more likely to happen, especially if combined with other triggers. Some of the most common food triggers includes aged cheese, beverages containing alcohol, chocolate, food addictive like nitrates and MSG, processed or cured foods, hot dogs, pepperoni, fermented or pickled foods. Are migraines hereditary? Yes, migraines tend to run in biological families. Up to 80% of people with migraines have a first degree biological relative with the condition. What are the risk factors of a migraine? A migraine can affect anyone at any age, from children to adults, women, and people assigned female at birth are more likely than men, and people assigned male at birth to experience a migraine. Other risk factors that may make you more likely to experience a migraine includes biological family history of migraines, underlying medical condition, regular use of tobacco products. How is migraine diagnosed? A healthcare provider will diagnose a migraine after a physical exam and neurological exam. They will also learn more about your medical history and biological family health history. Your provider may ask you questions to learn more about your symptoms, including what symptoms do you experience, can you describe the feeling and location of your headache, how severe are your symptoms, how long did your symptoms last, did anything makes your headache better or worse. Your provider may also order blood test and imaging tests such as CT scans or MRI to make sure there aren't any other causes of your headache. An electroencephalogram, that is EEG, may help your provider rule out other conditions. Who diagnose a migraine? If you think you have a migraine, discuss your symptoms with a primary care physician first. They can diagnose migraine headaches and start treatment. Your PCP may refer you to the headache specialist or neurologist.